In this video, I'm going to use a model to show you exactly what degenerative disc disease is according to your MRIs and X-rays. I'm Sebastian at Performance Place Sports Care, part of locally world famous chiropractors in Costa Mesa, California. Now, this is our model of degenerative disc disease of the lumbar spine, which is not too different than the cervical spine, but the anatomy is slightly different because the anatomy of the location is slightly different. Now, I'm going to show you guys in detail what's going on with this model, and you can use some of this verbiage that I'm using today and correlate it back into your image. Obviously, if you've had imaging done, you should speak to someone directly about interpretation of your problem, because a lot of the findings that we're going to cover today are not necessarily really common symptom generators. They're called incidental findings. They're things that are found on your image but are not necessarily 100% related to what's going on with your back pain today. Now, we got this really cool model here which shows a lot of the findings that we have with degenerative disc disease. The first thing to probably note here is I have actually a second model. This is another low back. And this low back, if you look at the disc height between them, the disc is in the middle, they're kissing right now. You'll see the one on this side, it's actually much more plump than it is on the one on the left, or maybe you're right on the video. The disc height overall is smaller. What typically happens here is the disc that is affected in this guy will lose pressure and it'll start to slowly flatten. That flattening creates some of the pain generators or some of the symptoms that you experience with degenerative disc disease, and I'll show you that as we go here. Now, generally the things anatomically you should be aware of is this is what we call the vertebral body. This is the vertebral body. This is the intervertebral disc. This segment right here, these two segments, this is probably more L4 and L5. Many of you have been told you have problems with L5 and S1 disc space, but the fact of the matter is we don't have a sacrum here. So we're not going to be able to show that exact segment, but this segment works very much similar. Now, when we look from the top here, this is what many of you have seen on your MRI. If you look from the cutting yourself in half view this way, you'll see this type of image here, okay? It looks like a circle with a little house built on top of it. This is the spinal cord in the middle, and actually in this model you can see part of the horsetail, the rootlets, as they come down through the spinal cord here too. This sideline view is one where you see sliced in half this way. Okay, and you'll see different sections of it. If we look this way, and this is you from the front here, the slicing happens with different regions, so we can see different sections of your spine. And the same thing happens here too. We're sectioning out parts of the spine this way, like you're cutting a loaf of bread. Okay. The other areas of the spine you may want to be aware of is the spinous process here. We have our antlers of the moose, which is the transverse process, and then we have the ears. These are, this is one section of the facet joint. If you look at this region down here, this is actually two facet joints. One you can see the space right in the middle. This one's a little bit harder to see, and that's because this area over here has more degenerative findings. It has more bone spurs. It has more osteoarthritis. And actually you can tell on the top one here too. If you see right here, this guy is actually pretty normal, and this guy kind of looks like a Groot head. It looks like it's grown up and over. And if we pan in on this guy here, again, it's fairly larger. Take a look at that there, and then we'll compare the other side. This guy's fairly smaller and more rounded. He has a smaller ear. Here's the moose's nose right there, okay? Bigger ear, smaller ear. And now we look onto this joint into here, we have the facet joint again. Here's the lower half, here's the upper half. This actually, the ear is actually the lower half of the facet joint of the region above. And this one generally looks okay. You can see the space in there. It doesn't look perfect, but not everybody needs to look perfect because everybody is different activity level and age. But as you see this guy over here, This guy kind of looks like that head like grew into the space there. There's much more bone around it, and because of that, sometimes there's pain associated with the actual facet joint here too. Now, another thing you need to be aware of as well is that like the disc space here is obviously more flattened, and because it's more flattened, what goes along with that is also the spacing here. This is the little hole that the nerve comes out of. This is called the intervertebral foramen, okay? And growth into the region is called foraminal stenosis. Some of you have severe, moderate, mild foraminal stenosis. And if we look at the other side here, this guy looks much more round in there, and it looks more open. And the nerve root coming out of it is probably going to be much happier. Okay? If we go back into the side that has more degenerative findings, again, it's more like a slice versus more of a circular opening. There's generally less space. And here's why this is significant. Okay? As the space between the disc, or the two vertebral bodies where the disc is at, starts to narrow or flatten, it actually smushes the hole and makes less space, which sometimes can create things like sciatica, and it also puts more pressure on the facet joints here, which can create localized lower back pain that sometimes goes into the SI joint, sometimes into the groin or hip region, and it creates what we call referred low back pain too. All right? Also, things that you may have seen on your image or x-rays are slang term, we call them fish lipping. This is where actually the lighting casts a really nice shadow here. You can see the dark shadow here. It's because there's a roof that's kind of coming out over towards the camera here. You can see it probably this way. It's blending this way. And actually with people who have more advanced degenerative findings in arthritis, osteoarthritis more specifically, you're actually going to see these things grow up and over and down and over, and it's like they're kissing almost. All right. So this can happen on the bottom surface of the end plate or on the top part as well, and they grow into the disc space. Bone marrow is something that's also found on imaging too, which you're not going to necessarily see in this model. Bone marrow is in the middle part. All right. And the last thing we should see on this one too is some of you have been told you have a ligamentum flavum, which is larger or hypertrophic. And so this area right here, this little translucent section in here, the maker of this model was nice enough to put it in there. This is the ligamentum flavum, and it's actually enlarged on this one too. And what happens here is, and when you consider this part here, and it goes through to the other section, which is the canal in there, all right? The canal roof has the ligamentum flavum on the roof. And sometimes when it's too enlarged, it'll grow into the canal, narrowing the canal, which can create central canal stenosis. Now what happens also too is when people arch their back sometimes, is the ligamentum flavum will buckle more into the central canal, which will create more pain. Also, in this area here, this is the smaller intervertebral foramen. As they extend their back or arch their back backwards, this hole also narrows down. As they bend forward and round their back, like sitting sloppy into a chair, they may feel better, or even into a child's pose. If you've been diagnosed with degenerative disc disease and you feel like there's no help for you, you can reach out to us. We've helped a lot of people here at Performance Place Sports Care find the right things to do to decrease the advancement and pain associated with degenerative disc disease. A lot of people have gotten back to completely normal activity. They feel like they can move throughout the day without any pain, and they feel like they have a sense of control. They don't feel like their back is getting worse and worse and worse. If you're looking for help, we can help you. We have virtual and in-person services. We also have a webinar in the corner which gives you more information about what's going on with your back, as well as other types of diagnosis that may be going on with you that is not actually degenerative disc disease. So take advantage of that. If you want help directly, reach out to us and subscribe to the channel, like this video. We'll see you next time.